Hello and welcome to Inside Oncology, a podcast by Cancer Matters. I am Poovenraj, Kanagaraj, and I'll be your host today. When people hear the word lump, it often triggers fear. Fear of cancer, fear of surgery, fear of life-changing news. The reality is far more nuanced. Breast lumps, thyroid nodules, and hormonal disorders are common, complex, and frequently misunderstood. Today, we are unpacking what the public still doesn't know about breast and endocrine health, from myths that cause unnecessary panic to subtle symptoms that are often dismissed as stress or aging. Joining me today are two experts who deal with these issues daily. I'm joined by Dr. Harjit Kaur, consultant oncoplastic breast and endocrine surgeon, and Dr. Normayah Kitan, consultant breast and endocrine surgeon. So, Dr. Norma, one of the conversations that even, I'm in my early 30s now, because they're like, or if you're not well, it could either be your stress, you could be, you're aging. So, I suppose the 30s is the new 40s now, and that's the conversations that we're having right now, right? When we get told that it's either stress or it's just part of your aging, we tend to just
forget about it.
What are the risks in dismissing sort of these signs? If you have pain or if you have got lumps, should people change their mindset and just take, it's not really all about stress and aging. You should go and check out. And could you shine a bit more light on this risk that comes with ignoring these signs as well? Because it's not just about ignoring these signs for weeks. It could be just like, for a whole year, I could just ignore it and say, I'm well into my 40s, this is part of life, right?
Related to endocrine disorders, right? Particularly the parathyroid, primary hyperparathyroid that cause the calcium high in the blood. And another condition sometimes related to the adrenal gland that produce extra hormone, particularly what we call a Cushing syndrome, or sometimes can be caused by, we call it pheochromocytoma. They are not very frequent, and the symptoms sometimes very, very vague and very general. So even the doctor tend to miss the symptoms. So I guess patients need to know their own self. And also for the doctors, they have to look at the age when they come and see you. So for elderly, postmenopause, or they are in the 60s, 70s, sometimes especially high calcium. So the presentations can be very, very vague. They sometimes become more forgetful, like dementia kind of symptoms, and they are tired, pain everywhere, bone pain. So we thought, they have arthritis. So actually, in actual fact, they have this what we call primary hyperparathyroidism, whereby the calcium is high due to the extra secretions of parathyroid hormone. But this condition is easily detected because you just need to check your calcium. But on the other hand, the other condition, we call it Cushing. Sometimes in early presentation, it might be missed. Because Cushing, we call it syndrome because there are a few characteristics in the features of the patient. So for us, sometimes we can actually do a spot diagnosis. When patient come, this is Cushing syndrome because they are moon face and then they are a bit obese.
Excessive steroid.
This one. So
the effects.
They are obese and then a lot of acne. So you can tell. But some patients in the early stage, I have one lady in her early 40s. So her symptoms was she feels that she is not well. She cannot explain, but she said that she is not well. And fortunately, she went to see the gynae first, and the gynecologist checked all the hormone. Everything is normal. And finally, because she is very persistent, she said, no, there's something wrong. So at the end of the day, the doctor's request was CT scan, and then so the diagnosis is you find something first. Abnormal, then you like go backward. Usually you diagnose the condition first, then only you image. But this one, imaging first and then you backward.
Circumstances can actually change.
Yes.
When you mentioned it's important for us to get to know ourselves.
Yes.
See, the thing about endocrine diseases, because hormones, right, is very particular. They used to say, they whisper for the longest time before they scream. So it can just go on, and you as a patient might just not feel right, but you cannot pinpoint what's going on, but you know something's not right.
Yeah, and then the doctor also sometimes.
And the doctors sometimes are at a loss as to, and then they will get labeled off as a hypochondriac, or you might say, oh, no, this
Supratentorial.
stress, maybe just stress. And then, they just blanket rule give you a stress diagnosis, which is actually very wrong. So I think the patient cannot be treated by a compartmentalized way, like symptoms-wise. You need to put them as a whole and try to find, because all the endocrine systems in our body are interlinked. So I think a endocrinologist, the right person you need to go to look at you completely and, make that diagnosis rather than seeing different doctors for different symptoms, because that's when things will go wrong.